Earlier, this is about the mammary gland, the physiology. The whole idea is to understand the development and working of the female breast in different phases of life. What happens at the time of puberty, later, when the female becomes pregnant, what changes are there in the mammary gland, and the postpartum changes, yani after birth, after vilada of a child, what happens, what further changes are there, and how does the gland work? This is the whole idea of our discussion. It's a simple issue and very easily understandable. Much of the knowledge here is not new, we are just recollecting the facts. Okay? Let's rearrange things and have a quick look. So, doesn't have complicated mechanisms here. These are the simple objectives that we have to talk about. Actually, you must understand few terms which are important regarding the mammary gland physiology. And one by one we'll take up these terms. This is about the anatomy which you have done earlier. It's the inside of the breast, showing you the structure, histological structure, so that you know that what is the passage of the milk secretion during the phases when it is required. Pregnancy and later in lactation. Alright. So I'm sure you are familiar with the term alveoli and the lactiferous ducts and lobules and all those terms. Okay? No need to go into the histology again. The only thing is that there are a few important terms here, and look at the arrangement. One point of view. Okay? Look at this magnified diagram here. The milk duct or the lactiferous duct is there, which is a dilated structure having a sinus or a dilatation for the lactiferous sinus. Okay? But the sinus is basically for the storage of the milk. Whenever milk is there, it should be stored and it gives you a good quantity. Later, if you see, here in the low part of the diagram, you will see that these special alveoli or the milk factories are surrounded by very special cells which have a dual characteristic of being epithelial in nature as well as contractile in nature. That's why you call them myoepithelial cells. Okay? Double properties, double edge.
Yes.
Okay? Well, they serve as an epithelial cell and they serve as a contractile cell to exert an external pressure over the alveolus whenever it is needed. And these cells are hormone sensitive cells, remember. Okay? So whenever a relevant hormone comes, these cells are stimulated and they will contract. Once they contract, they will squeeze through. When they squeeze, they will exert a pressure from outside over the alveolus, and that will drive the milk which is present in the lumen of the alveolus into the lactiferous ducts or into the milkways. And finally, okay, the milk will move. So it's for the squeezing of the milk, okay, just to express the milk or to let down the milk. Let down means milk is coming out of the breast or it's moving forward in the ducts of the breast.
Right.
Okay?
Okay.
Let's go forward very quickly. Look at the terms once again. I said earlier that we need to know some terms, which are very easy terms, okay? But you have to be clear about the term. Okay? One term is mammogenesis. It's self-explanatory, if you see. Mammogenesis. Genesis or formation or development of the mammary gland. Now the point comes that when does it happen? The mammogenesis starts in the phase of embryogenesis, and the glands are formed at that time, isn't it? The mammary gland in the female or the breast tissue in the male is developed as an appendage of skin, okay, as a modified sebaceous gland. Later it develops into the male breast or the female breast, and it happens in the embryological life. So the story starts from the embryological life, but then it is not needed. At that time there is no need. We are talking about the term mammary gland, which we are keeping for the females, not for the males. Okay? For the male we can call it the male breast. For the female you can call it the female breast or the mammary gland, because then it has another important function of milk production, secretion, and milk expression. So mammogenesis is multiphasic. You start that process in the embryological life, then this process is not really triggered after birth till the age of puberty, and the male and the female breast remains the same. If you see the breast tissue externally of a boy, little boy or little girl, you cannot discriminate between. Okay? Why? Because at that time there is no further growth, there is no differentiation.
Right.
If you check a 2 or 3 year little old girl or boy, you can hardly differentiate anything between the tissue externally. But later, when the time of puberty arrives, you know that, okay? Then hormones trigger the development of the female breast,
Right.
and they have no action on the male breast. The male breast remains as it is. There is a growth of male breast to an extent that it suits or it matches with the growth of the person at the time of puberty or the secondary sexual characteristics, but it's not like the female breast growth.
Right, but that's not the gland, that's the bones and the muscles, right?
Yeah. Even if the size of the breast increases a little, that change has to happen because the boy is turning into a male. So it is according to the proportions of the body, whatever is in the genes.
Right.
It has to be decided. Okay? But then later there is no further development, there is no further growth of the tissue. The milk forming tissue will not develop in the males, but the milk forming tissue will develop in the females. We know that. Okay? So that's the basic difference. Anyhow, mammogenesis at the time of puberty. Now the females meet mammogenesis in true sense, and females develop the breast. Okay? A suitable size of the breast according to their body proportions at the time of puberty, they develop it, and this process is further worked up in their life when they become pregnant one time in their life. Okay? There's further development, and even after the delivery of the baby, that phase continues for some time because now she's a nursing mother. She's a lactating mother at that time. And she has to maintain the process. But mammogenesis, if you divide into phases, okay, it's prenatal and postnatal. Postnatal, pubertal, and postpubertal. When you say postpubertal, you mainly mean to say it's the pregnancy state, right? Simple. Okay, that's the first term. It's about the development and the growth of the female breast. The second term is about lectogenesis. The term lecto pertains to the milk actually, okay? And milk comes from the mammary glands. So the term lectogenesis is for the initiation of the milk production. Now that's very interesting. Lectogenesis. Now, again going back and dividing into phases of life, where will you fit this process of lectogenesis?
Yeah, definitely.
It's, yes, the true sense, Abdul Majid is saying that start from pregnancy. This is relevant really because in the pregnancy, milk formation starts in an anticipation. Okay? Just as a precautionary measure because you never know when the baby is going to born. Maybe a little earlier than before. So you don't wait for lectogenesis to start at the 9th month or at the day of the delivery. Okay? You have to be careful. So the nature is very careful about the process. Nature makes it initiated somewhere in the middle of the pregnancy, 4th to 5th month of the pregnancy, and there is some evidence of milk secretion coming, the milk formation coming in the breast, and to some extent a little milk secretion in the ducts is also there. Okay? This is again a wonder of nature. So early, yet so wise really. Okay? It's a wisdom, isn't it? Because some babies are born at the age of 6 months or 7 months. If the mother's breast is not ready, then what will the baby do at that time? Okay?
Right.
Don't think about our advanced situation that we have the top feeds module and the bottle feeds and all that. Imagine about a village or a mountain where a lady is living and without any means of supply, the only supply is mother. In that case, what will happen? Isn't it? So, again, yes, so lectogenesis starts from the pregnancy and it slowly and gradually approaches. As the pregnancy advances, it moves with that and it increases. Because you will have hormones coming, a very strong background of hormones in the pregnancy. Okay? Very high levels of hormones are there, which are very supportive, very facilitatory. After that, the full-fledged or the maximum lectogenesis is the requirement of puberty is done, pregnancy is done. After that, go further. No. What phase of life when you have the maximum lectogenesis?
Yeah.
Lactating mother, think about the lactating mother. Once she has given birth to the baby and the baby is in the world now, mother's breasts are now free to work maximally at that time, and they will continue for a long period. And again, it's a miracle. It's kind of a physiological miracle that mother can support the baby to as long as 2 years or so of the age as it is mentioned by Quran.
Right.
Okay, it's a message coming in Quran, and Quran tells us about the physiology or the length of the period where these mammary glands are working. Look, isn't it?
Yes.
So, lectogenesis, and a very, very interesting point about lectogenesis, Shabab. It's very interesting to know. And someday, you do it yourself and you just check. If you are working in pediatrics,
Okay.
in the ward of neonatology, if I say neonatology, what does it mean?
Yeah.
Neonate, okay? It's maulud, just born, really.
Yes,
okay?
exactly.
Not old, just born. Over few days, 1 to 3 days like this.
Yeah, that's
Initial few days, up to 1 week, we call it a neonate, really, in true sense, okay? So, because it has the characteristics of very newborn for 1 week. If a newborn comes to you, a male or a female, baby, I'm saying a baby, 24 hours old baby, 48 hours old baby, okay, in your hands, and you are examining that baby. Male or female, I'm not saying female, I'm saying male or female, okay? And you start checking the baby. If you see the breast of the baby, you will have nothing wrong with it, to say, like a normal baby's breast, okay? Male or female, nothing wrong with that. But do one thing, go and check, okay? Squeeze the breast area, okay? It's very little actually, it's like a dot, it's a little dot actually, and you just squeeze around that dot, okay? You will see a drop of milk appearing in many of the babies, not all the babies, but in many of the babies, you'll see a little expression, like a little dot of milk, and you'll be amazed by this wonder that milk is there inside that baby's breast, whether it be a male baby or a female baby. Okay, you might wonder, well, for females maybe there is a background, so it might happen, but why is it happening in the male babies? Anyhow, for babies, it's really amazing. What do you think?
Mother hormones?
Is it, yes, it is normal or abnormal?
No.
It's normal. And as you were saying very rightly, mother's hormone. Baby is very well supported in so many physiological aspects from mother. The immunology and for physiology and for so many things. Mother is supporting. This baby has just come out. It was inside mother 24 hours before. So it was supported by mother. So the same hormones, same functions are there inside. Some of the mother's hormones, maternal hormones are there. And these hormones still have an effect. So mother's prolactin is there inside the baby's blood. Mother's estrogen, progesterone were there inside. So a little construction was done by estrogen and progesterone, and now prolactin, because it is mawjood, also in the baby's blood for a couple of days, it will remain there. It will slowly and gradually decline and will be metabolized. And then it will not come again, okay, because it's maternal. Anyhow, for quite some days, there will be a little milk expression in a neonate, and that milk is known as like a magical milk, isn't it? Okay? From nowhere, witch's milk, you know that. Okay? So that's a very special aspect of milk secretion which can be seen in neonates. Anyhow, it's not truly in sense lactogenesis because the baby is not in true sense producing by his or her own hormones, okay? It's the gift of maternal hormones which is transiently producing a little amount of milk.
Yes.
galactokinesis. Kinesis means when you are moving or squeezing, okay, the breast apparatus, the myoepithelial cells are doing their job. You are compressing the alveoli and you are expressing, moving the milk first in the ducts by external pressure and squeezing the milk through the nipple. And that process is known as galactokinesis. When milk starts coming out of the breast, appears on the surface of the breast, or it goes into the baby's mouth during suckling, then the process is galactokinesis. Okay? In other words, you can call it milk ejection, isn't it?
Yes.
Okay? But Shabab, let's go back and talk about few terms. Milk formation, milk secretion, milk ejection. 3 terms. Okay? Be clear about the three terms. Milk formation, milk secretion, milk ejection or expression. When I say expression, means it is expressed. Expressed means visually, you have a visual evidence to see that milk coming out. Okay, that's milk ejection. Milk expression, milk ejection, milk let down, same terms. When I say, oh, milk is having a let down means it's coming out. You are letting it down, coming out of the breast. You are expressing the milk out of the breast. You are ejecting the milk out of the breast. It's galactokinesis. So 3 terms for the same process. But if you go back, milk secretion and before that, milk formation, how do you understand that process? When I say milk formation, what do you mean by that?
It is being made.
Made where? Yeah?
Most probably inside the cells.
Inside the cells. That's a beautiful answer. The concept is intracellular. Basically, mainly it's intracellular. Well, the factory is the cell. So the cell will make and manufacture the milk. After being manufactured, the milk has to be secreted. If you say secretion, then where are you thinking about?
Into the lobules.
Into the extracellular spaces in the lumen of the alveolus or into the duct system. So when you are filling the lumen of the alveolus or the alveoli and the consequent duct systems, if you are bringing the milk there, then you say, oh, milk has been secreted from the cell, from its source, into the area of the storage, isn't it? That process of coming out is known as secretion. But at many times, many of us confused ourselves between milk secretion and milk ejection. This is secretion means, oh, it's coming out of the breast. It is not. Okay? So please clearly make a differentiation and use the 3 terms separately. Milk formation, milk secretion and milk ejection. I'm sure we are all clear about it, right?
Yes, definitely.
Okay, good. It's very easy. It's just only to brush up your concept. You know it, mashallah. The last term is galactopoiesis, which is a complex process, okay? Because that has to go very long. Okay? It has to start at the time of birth. You have to maintain that true, full-fledged process of lactation, and that goes indefinitely. Indefinitely in the sense that for a very long time. Indefinitely is a loose word actually.
Yeah.
Okay? Well, it's around 2 years to up to 2.5 years. Sometimes mothers feed for 2.5 years and they express milk. Okay, they usually claim that the milk is coming and the baby is there and baby is still taking. So 2.5-year-old boy or girl still
walking and running.
Okay. At times hanging with mother, other times walking and running and playing, again coming to mother like this. It's beauty really that such an age of 2.5 or even more, okay, and still milk is being expressed. Okay, it's a very, very long function by the breasts, isn't it? Not easy. Not all mothers can do it. Okay, my salam to all those mothers who continue this process really, because it's not an easy process. Nobody is patient these days to continue this process as long as 2 years or so. It was a time of that, right? The prophethood and all that, when we used to say that, well, mothers not only fed their babies at that time, well, they used to feed other babies.
Right.
Okay? Being paid or not paid or whatever, but that was a profession at that time also, you know that. Okay? So they're feeding multiple babies at the same time and continuing this process for a long time.
Impressive.
Yeah, it's very, very impressive. Okay? Impressive for that gland to work so long. It's not an easy job.
I mean psychologically impressive.
Psychologically, it's like it has to be a very stable mind, okay, and a very tough mind to continue this process for so long. Okay? Otherwise, for a couple of months it's there and then it slowly goes away. Okay?
Right.
These days, if you see, mothers do feed, but
People
not
are
as
weak.
much.
People are weak these days.
Yeah, definitely.
And I spoke unto them.
So galactoposis. Are these four terms clear, Shabab? Okay, thank you very much. The rest of the process will go quickly.
All right.
Mammogenesis, we know much about it really, because if you consider mammogenesis during the pubertal phase, when the puberty is there and the girl is developing the breast, definitely in order, in succession, some hormones will come into your mind. First hormone which comes into your mind is estrogen. The second one which comes into your mind is progesterone. The third hormone which will come into your mind, prolactin will come. We'll talk about it. Prolactin, how much, how long, is it or not? Okay, but let's hold it. Two hormones are very important, the estrogen and the progesterone.
Yes.
Estrogen is the primary construction hormone.
Infrastructure.
Okay? Yeah, the whole infrastructure, the inroads and the pavementing and development of the area, plus laying down of the fat and everything
and so
is done by the estrogen.
Yes.
So the shape determination, initial shape determination, as we talked earlier also.
But it doesn't ejaculate.
Yeah?
Doesn't ejaculate.
Milk. Well, the milk. Okay, that's fine. No, not yet, because estrogen is one. You still need progesterone, and you still need a very important hormone, prolactin. Okay? And yet to eject the milk, if you're saying ejection of the milk, well, no. It needs another very special hormone that we'll talk about.
Oxytocin.
Okay? Yeah, we'll talk about that. Okay? Not yet. Okay? It's too early, really. Okay? Even milk is not formed at that time. Right?
Right.
It's not there in the breast. Okay? Really, maybe in some females it might have happened because of the prolactin or something, but it's not normally.
Just buffer.
Yeah, it's just the development of the breast at that time. It's happening. And, okay, so estrogen is doing its job,
right,
giving it maximal to the breast, the shape, determination. Progesterone is another friend who is working at that time for the further development and the growth. The stroma and the duct system, you know, it's meant for the estrogen. And the alveoli and the lobules and some more fat deposition and the epithelial growth is done by the progesterone. Okay? So every hormone has its definite role. Okay? Then comes the role of prolactin, which may have some stimulating effect on the epithelial growth only. Okay? Not really. And still, it's a question mark.
Yes.
In the humans, how much is the role of prolactin at that time for the secretory epithelial growth? In animals, yes, we have documents, but in humans, we are not sure about. But we assume that there is a little contribution of prolactin even for the growth and development of the
Oh, it could make sense.
Yeah, little, okay? Just in order to have the full development of the breast, because breast is now ready at any time. Because we have some prolactin always module in a little amount,
right,
but it is there. It's not absent from the female. It's not even absent from us. We have prolactin at this time also.
Yeah.
What is it doing?
Nothing.
Nobody knows. Okay?
Hopefully nothing.
No, it has to do something. Okay? If it's given by the nature, we have not yet discovered probably. Okay? It has something to do with other hormones, regulation, or giving some share in the male sexuality regarding the sexual function of the male or the fertility of the male. There has to be some secret about prolactin related with this. Just like you have FSH and LH coming and controlling the functions, prolactin probably has a role because excess of prolactin will produce some problems of impotency.
Yeah, which is why we don't
as
want
well as going towards subfertility or problems in spermatogenesis also. So that shows clearly that a little amount is needed for some of the process really at least. Otherwise, why would we have that hormone? Okay? So maybe one day it will be discovered. Alright. Apart from these hormones, estrogen, progesterone, the main hormones, you need a background, a little background of other hormones also. Okay? you also need some other hormone. If I say you need a permission of little hormones for the estrogen and progesterone to work properly, first you make a ground with the help of other hormones. Can you think of some other hormones which gives you a background for the best actions of estrogen and progesterone?
Probably growth hormone.
Okay, for the breast, gonadotropins are going, Abdul Majid, basically the gonads.
Yeah.
We don't see them coming and controlling the breast. We have not found the receptors of FSH and LH on the breast tissue.
Almost probably growth hormone.
Yeah. Now, when you are thinking logically about cortisone or the glucocorticoids, why are you thinking about this hormone? Any idea? What if you have cortisol there and acting on the breast? How will it help the breast? Okay, so it means something to do with the metabolism of carbohydrates or proteins or the fats. Okay, it's one of the metabolic hormones. Just like cortisol, as you mentioned, can you name some other hormones which have a permissive effect? Insulin, growth hormone.
Right, I got two.
And what else? Very nice. Think of all the metabolic hormones, my dear boys. Just think of all those hormones.
Many of them.
Okay? Yeah. So you have named the
Are we talking about
hormones.
anabolic hormones?
Yeah, because all these hormones are required to control the best metabolism of the cells, and this breast tissue is a very highly developing tissue at the time of puberty. If you want estrogen and progesterone to work more and best of their actions, you need a maximum background of all these hormones which are supporting the breast, because you are providing all sorts of nutrients to the cells in the form of amino acids, fatty acids, and the glucose to build up the actions of estrogen and progesterone, whatever they want. So now they are free to perform the actions.
Yes.
Okay? So you need the background hormones, which are metabolic hormones. You need the main workers, which are the developing hormones, estrogen and progesterone. And you need workers like giving final touch, prolactin. Okay? Maybe. So this is about...
There's a grand structure, I think.
Yeah, it is. Okay.
Grand architecture.
It's like a high-rise you're building these days in Dubai or in Emirates or in some of the areas, or even in Saudi Arabia, anywhere. When you're developing, you have to plan really with so many workers. It's a very special plan that you have to make. So you don't require one or two hormones, you require a number of hormones for that. Anyway, it's simple and it's very easy, and it's quite logical. I'm not reading all these slides, you know that. Okay? You can do it better than me, mashallah. All these hormones are there. Okay, so idea is now the next phase comes, and just compare it with the time of puberty. It's only a comparison. Okay? Well, you know, what else do you want? You have all the hormones working at the time of puberty. You make a list of hormones and you finish that. Now what? What's so special about that? In pregnancy, we claim that the breast further increases in size. The mother, even though not lactating, but the growth of the mammary gland increases. Okay, sometimes twice as much as it was before, sometimes a little more than that, in different proportions in different females, but there is a growth. Okay, it means the inside tissue is expanding really. There is hypertrophy as well as hyperplasia going on, and the whole factory is increasing in size. Now, what is happening around? Okay? And why is it happening around? First of all, you have a very high level of hormones. Do you agree with me?
Yes.
Which hormones?
Estrogen.
Estrogen. Up to their best, up to their maximum. You will never see these levels again in the life of female after the birth of the baby. Okay? As high as these levels really. Okay? The receptors are maximum. The hormones are maximum. So definitely the tissue will further grow. Okay? There is a maximum stretch of that growth. Alright? Agreeable and understandable. There is no problem. Prolactin levels become very high at that time. Before puberty, prolactin was there, I was telling you. Okay? In us also, in females also, but that was a little level of the prolactin. Now you see the graph of prolactin, it's going up and up and up, and it's going quite high. And it maintains a plateau like this. So the graph of prolactin is very high. This is the story of the middle part of the pregnancy. Okay? Couple of months have passed, and now you are in the third, fourth month of pregnancy, and you see a high level of prolactin. The whole idea is, what is prolactin doing at that time? What do you think?
Lactogenesis, isn't it?
Estrogen responds to the secretion
Of?
relative.
Okay. Progesterone is going in. Okay. So you are telling me about, Abdul Mohsen is telling me about why is prolactin coming. He's answering why is it high. Okay. Because there is removal of inhibition of the prolactin secretion, and the prolactin inhibiting factor or the hormone is not there.
Disinhibition.
Okay. Yeah. It's disinhibition. So it's free. It's free. Free to go in the blood. Free to act on. No. Hold it. Free to go in the blood. Free to reach the mammary gland. But is it free to work in the mammary gland? No, not at that time. Because if it works freely, estrogen is stopping it. Say, hold it now. Don't be so smart right now. Okay, you are there, but hold yourself. Okay, I will allow you to some extent, not more than that. You have to wait for another few months, not like that. Okay, you will not go unlimited. Okay, so prolactin is coming, but prolactin cannot do anything much. It is working to some extent. It is opposed by estrogen. It is also opposed by progesterone at the level of the breast. At the level of the pituitary and hypothalamus, you are facilitating. Okay. At the opposite level, what? A special situation really. Not easy to understand, but it happens really. Okay. So these hormones have so diverse roles that at one place they are doing something else, at other place they are doing something else. Isn't it?
Yeah.
Anyway, on the breast, you have a red signal. Okay? Not exactly red signal. Some milk is being secreted because it's now third or fourth month, and some prolactin is acting, but not in the same proportions as it is there in the blood. Such a high level and such a little worth of prolactin. So some milk starts appearing. Okay? So milk is there in the breast. Initiation happens, but not freely. Okay? So it means you are still opposing. A very strong opposition of estrogen and progesterone is there. Maybe some other factors, mainly these hormones. Am I not confusing you? Is it okay? Alright. Again, to further develop the breast, you need the full support of all other background hormones. So just magnify what happened in the puberty. Now all the hormones are acting more. All the background hormones, all the foreground hormones like estrogen and progesterone and prolactin is also there, which has further stepped forward, and it is now working to some extent. Not fully, but partially it is working here. Okay? This is what is happening in the pregnancy. It continues the same till the end of the pregnancy. Till the end of the pregnancy, the milk secretion does not become so much. It is there, but it is not usually expressed easily. And the milk is very thick in nature inside, you know. Okay? Look at this graph very quickly. Okay? Look at the level of the progesterone. This is progesterone, the red hormone. Can you see that?
Yes.
Look at the level. Just before the birth, look at the level. Isn't it very high? Here.
You mean prolactin?
Yeah, this is prolactin, this one. Okay? This one, prolactin. So just before birth, the level is high, isn't it?
Right.
At the time of birth, the level is high. Even after birth, the level remains high, isn't it? And then you will see a gradual decline. Okay? The prolactin, even though the mother will have free lactation now, okay? She will feed the baby just after the birth. Okay? Just after the birth, which two major opponents have gone?
Estrogen and
Estrogen
progesterone.
and progesterone have gone. You know, placenta is gone, hormones are gone. Hormones are gone, inhibition is gone. If inhibition is gone, now
Prolactin works.
prolactin, even though it's declining over days and weeks, but still this level is too much to provide a very good lactation, because now there is no opposition. There is no opposition. So even though decreasing level, but alhamdulillah, that level is far enough.
Slow and steady wins the race.
And slowly, steadily it is coming throughout the period. A regular mother who is lactating the baby, she will also have a decline of the prolactin, slow decline. A mother who has not fed the baby, like a working mother, or some mothers are psychologically disturbed, or they have a fear. There are many problems with the females. Okay, Because if you consider, most of the females will feed the baby, but there are females, owing to certain problems, they don't feed the baby right from the day one. When they don't feed the baby from the day one, don't expect that the prolactin will remain there. Prolactin has to fall very quickly. There is a sharp decline of the prolactin. In a couple of weeks it will come down.
And so much effort is wasted.
Yes, the effort is wasted. Yes, Ari?
Just after 3 months, the prolactin will decline. What about, you told us before it will still for 2 years.
Yes, this is what I'm saying. Okay, now that's a good question. Ali is just worried about the situation that it's coming down to like 3 months. Ali is seeing the graph very cleverly and he's asking that, look at the level of 3 months and do you expect this breast, this level of prolactin to continue for as long as 2 years? Well, Ali, this level of line of prolactin is a baseline of the secretion. One very good point about the prolactin that we are just going to discuss is that prolactin level is the baseline level here, and whenever it is needed from this baseline, when the mother starts feeding the baby under this certain condition, all of a sudden the level will go up and it will come down again. It will go up and come down again. So the baseline is decreasing and decreasing, and even this low baseline will have the spikes of the prolactin secretion coming whenever the mother feeds the baby. So the baseline is going down and down and down, but over that baseline, whenever the mother wants and whenever the baby wants, okay, it's a system that will give and generate more prolactin for a little time, and again it's coming down, and again it's coming down. When this prolactin falls to the level of this much really here, that is the time probably when you don't expect anything at that time. Okay? But that time can extend up to the 3 months, 2 years, 2.5 years, like that.
What if the baby continues after 2.5 years? Will it continue?
Well, some mothers claim that they affect the babies for 3 years. It's variability, but usually at that time prolactin has fallen low. I'm not saying that the mothers will have the same yield of milk as it was here in this time or in this time. It will also be here. The yield of the milk is decreasing. Why is the yield of milk decreasing?
Because the baby is now eating something else.
Yes, the baby is now eating, mashallah. Okay, the baby is having the weaning has started. The baby is becoming self-sufficient, eating so many foods. So just as an emotional attachment or as an emotional requirement, baby wants the milk. The baby will get this much little amount of milk, but that attraction to go to the mother and get some milk from the mother is more of emotionally derived or psychologically derived, rather than the nutritional requirement of the baby. You know, nutrition is coming from other sources.
Right.
But because emotionally attached to the mother and in a habit of going to the mother, that creates the continuity of the milk. Okay? Otherwise, mother is not giving much to the baby at that time. Baby is not receiving much from the mother. Anyway, this is all psychology really. It continues. Okay? Anyhow, did you get the idea?
Yeah.
So there are different phases of lactogenesis. Lactogenesis 1. In mid-pregnancy, when you have little amount of milk secretion, you call it lactogenesis 1. Okay? Then lactogenesis stage 2 here. Okay? From the birth, from the time of birth, okay, to for about couple of days, it is lactogenesis 2. Okay? That is also difficult because the free flow of milk is not there, you know that. Okay? For a couple of days there is a difficulty. The quality of milk is very good, but the quantity of milk is questionable. It's not freely flowing because it's not clear the thick milk is there. After that, it's a continuous and a free flow whenever the baby wants. Okay? Lactogenesis 3 is that maintained phase after a week or so, and it continues for a very long time. Okay? So it's very simple. Lactogenesis 1, 2 and 3. 1, you keep it for the pregnancy. 2, you keep it for a couple of days after birth. And after that, 3. Okay? Few points about prolactin only, because it's a special hormone and it needs discussion. We'll not talk about estrogen, progesterone. We have had enough of it. Prolactin is a very special hormone. Okay? It's coming from pituitary, from the electrotrophs. Okay? This hormone, when is it secreted, in which phases of life, we have talked about that previously. No need to talk again. Okay? This hormone, prolactin, is controlled by a very special hormone or a substance, and that is coming from the hypothalamus. The only hormone of the pituitary, Shabab, remember, always remember, the only hormone of the pituitary which is controlled by only inhibitory hormone, which is inhibited all the time, is prolactin. The other hormones of the pituitary, okay, when they are controlled by the hypothalamus, they have releasing hormone, they have inhibiting hormone, they have releasing hormone, they have inhibiting hormone. But for prolactin, it is wahid hormone that is only having inhibition. If you remove inhibition, it will work. If you keep inhibition, it will not. If you remove inhibition, it will start. If you again maintain that inhibition, it will not be secreted. Okay, so keep it in mind. Ali, now graphical answer to your question. Look at the baseline. This is the baseline of the secretion. Alright, Ali?
Yeah.
Okay. And over that baseline, can you see the spikes? Whenever the mother is feeding the baby, whenever prolactin is increasing, it is increasing in spike. Because the feeding time is a little time, really. It's hardly for 10 to 15 minutes, 10, 15, 20 minutes for the baby. Okay, not more than that. Usually. Within half an hour, maximally. Okay? So, it's a little time for the feeding, and for that time, as long as the baby is suckling, then the prolactin will remain high. Okay? And then you will have a fall in prolactin. Okay? So, prolactin increases and decreases, increases and decreases physically many times during the day. Even in one day, as long as the mother is feeding. Now the mother is feeding 3 times, 4 times, 6 times, 8 times, whatever the number is. So at that time, prolactin will increase, and then again it will come to the baseline. Okay?
So PRL is prolactin resting levels or what?
Wait.
PRL.
So PRL is short form of prolactin. Okay?
Oh.
PRL is denoting prolactin as such. Okay? Alright. Okay. Actions we have done. No need to do the actions. We have done with the actions from the...
From reproductive 1.
Yes, okay. So it's easy. Look at this one. Just a regulation. Look at that regulation graph and don't look at anything else. Okay? Hypothalamus, pituitary and breast. 3 levels of control. Hypothalamus is giving a special dopamine, which is prolactin inhibiting hormone. Shabab, the other name of the prolactin inhibiting hormone is dopamine. Hypophyseal portal system. By the blood, it is reaching the anterior pituitary, acting on the antipituitary and closing the release of the prolactin. Okay, it's a continuous inhibition coming from. If you remove this one, then you will have free prolactin being secreted. Ali?
Also, there is certain product that needs to help.
Well, Ali, I'm just coming to it. I'm not very much convinced with this one. Many books, many diagrams are there like this. Okay, it's just a hypothesis. We have an imagination that there is some stimulating factor also coming from prolactin, but actually we are not sure about that. So it's better not to discuss very much. Maybe there is a factor in the humans. If it is a factor, what is that factor? Nobody knows till today. No document will say that it's a definite prolactin releasing factor and it's parallel with the inhibition. No. So we have shown it here that maybe there is some role of the prolactin releasing hormone which we are not sure about, but it may be there. Okay? Anyhow. There is one more thing interesting which is shown in the diagram. Can you see from the other side what's happening? Yeah, okay. The hypothalamic thyroid releasing hormone has some action, a parallel action to some extent for the prolactin. Can you see that? Yeah. Right? And finally the action here. Okay, that's okay. There is no problem. You have understood that. So TRH is acting as the prolactin releasing hormone, but we claim that maybe there is some other thing also, okay, apart from this TRH. TRH has a slight role. Anyway, regulation is done. Okay, now one or two terms which are very interesting terms, and it's the requirement of these days basically. Okay? Mothers have problems. Definitely, it's not an easy job to feed the baby. continuously, okay? Imagine if this job is given to us, what will happen, okay? Imagine. So we don't have that temperament really. Males don't have temperament. Females are made to have that temperament, and that's why they continue for such a long time.
Used to.
See, it's not easy saying used to it, okay? But they are meant for it, okay? By Allah, really, okay? From Allah it has come, okay? It's a gift to the mother, but again, it's a very tough job.
Our jobs are tough too. You don't see us complaining.
Well, don't protect yourself, okay? The mother's job is far, far tougher than our job, really, okay?
You could say that, but
Hey,
you have to.
Ahmed, you're made tougher than female. Don't compare yourself to the female. Female is not as strong as you, really. Emotionally, psychologically, physically, mentally, no way, okay? Females are not. They are made for other purposes, and they serve it beautifully, alhamdulillah. And one of the great jobs done by after pregnancy and delivery of the baby is to give rise, okay? Not only bringing up of the child, but feeding the child is not an easy job, okay? Now, in many mothers, there is a problem that they claim that they cannot produce enough of milk, okay? And they want to feed the baby, but they cannot.
That's a good woman.
Okay? Yes. And sometimes it's a general problem also. Sometimes if there is any problem, then there are some drugs which can stimulate the action of milk secretion at the level of the breast, probably. They somehow, I don't know what is the exact action done by the metoclopramide. Do you remember what is metoclopramide in pharmacology?
It's right there, dopaminergic blocker.
Yeah, it is, but where did you read that? It is. Yeah, it is dopaminergic blocker. Okay? Yeah.
Well, it's a
Metoclopramide. It's a very famous drug. Very, very famous drug.
It's also written, it's an antiemetic.
Okay, if it's written, then I'll not ask. I didn't see the slide actually. So if it's maktub there, it's an antiemetic, very famous antiemetic agent. Okay, but at the same time, metoclopramide has a very special action. It's anti-dopaminergic. If it's anti-dopaminergic, what is it doing? It is
In what regard?
blocking the prolactin inhibiting hormone, isn't it?
Right.
The action. It is competing with the dopamine receptors, with the dopamine, and it is blocking the receptors. So dopamine cannot work on the receptors in the pituitary. If dopamine cannot work, it means now these cells are free. Okay? No inhibition coming from above, alhamdulillah. If no inhibition coming, there's a chance of more prolactin. And there's a chance of more milk secretion, isn't it? Okay, so it's metoclopramide. Okay, very good drug. Sometimes mothers don't want to continue. Okay, for certain reasons. Some reasons are valid reasons. Some reasons are not valid. They are having some problem of acute inflammation or engorgement of the breast, or developing some tumors or something like that in the breast. Sometimes problems can happen. So there could be a medical reason also. But there are some social reasons, there are some community reasons also. Working mothers in the West, many of them, they don't want lactation because they have to join. Okay? They have to go back to work, they have to join. And in that case, they cannot feed the baby. The job is from 9 to 5, from the morning. So they have a babysitting, but they cannot arrange, okay, like a mother, nursing mother, as we had in the past, to feed the babies. Okay, so it's the top feed. So the mothers now will have problem. What will they do with the milk which is there in the breast? Definitely, if they don't feed, after a few weeks, this milk will disappear because there is no stimulation coming. All right, gradually. But for that time, initially there could be a problem. And the breast is engorged with the milk. And there could be tenderness or the pain or discomfort or sometimes nodule formation. Anything can happen in the breast if the mother discontinues and for a long time. So what they do is that they want something to stop the milk secretion or to decrease the milk secretion. Okay? There are some drugs which can decrease the milk secretion. One of the drugs, if you want logically decrease the milk secretion, what do you want? What will you do? Dopamine. Bring dopamine more dopamine. Any drug which is like dopamine or which can stimulate the dopamine. Great. Any. Such a weird concept, Abdurrahman.
I'm gonna make a drop that.
Giving cocaine to money, right? Great. Great. Alright, so bromocriptine is one of the drugs, okay, which is used in Parkinsonism, basically, Parkinson's disease. Okay? Dopamine agonist. And that stimulates the receptors. Okay? So it's very easy. This process is called ablactation. If you want to suppress the milk production and milk secretion, you call it ablactation. You are switching it off, right? So this is required by many mothers really, intentionally, okay, on purpose they require. They have their reasons, it's up to them. Other factors, very interesting factors, 1 or 2 points and I'm closing the discussion, okay, it's done. Okay. Very interesting points, okay, the reflex that we talk about first. Look at this reflex. The maintenance is known as galactopoiesis, basically, okay. You will read it yourself. The baby suckles the milk and this process continues for a long time, for years. And this process will go on, no problem. Okay? We claim that there is a local factor present in the milk also, which is called feedback inhibitor of lactation. Okay? And this is coming in the milk. And if it is in the milk, it has a feedback inhibition effect on the cells and further milk secretion is inhibited locally. Okay? Yani milk has a special factor, inhibitory factor, and that has an autocrine control or self-control, which is giving a feedback. You read it yourself. Just look at this reflex. There is a very special reflex for the milk production and milk secretion in galactopoiesis. Now, usually the baby starts suckling. The baby touches and holds the nipple in the mouth, and the tactile stimuli, the touch stimuli from the baby's lips and mouth, okay, is going and sensed by mother's sensory system, and it's going to the hypothalamus of the mother. From the hypothalamus, see what is happening. You can see a very easy flow go. Well, the signals will go to 2 sides of the pituitary. One is anterior pituitary and the other is posterior pituitary. The question is why? Both are very important. For anterior pituitary, you want prolactin, isn't it?
Right.
Because you have to secrete more milk.
Posterior oxytocin.
From the posterior, you have to bring oxytocin for letting the milk out, let down or expression of the milk. Okay, so both are being done side by side. This whole reflex is a very, very special reflex. You will hardly find these kind of reflexes in the body. Now, tell me, when you say reflex or a reflex arc, what do you mean by that?
Stimulation.
It's a whole pathway. Circuit. It's a circuit, isn't it? Right? Look at this circuit. What do you find special in this circuit? Just identify and tell me. What do you find so special in the circuit?
Sensory outcome.
Yeah?
3 bars.
Okay, because other one?
The sensory outcome.
Okay, what is that? What is so special about the sensory?
Neural and
Okay.
explosive hormone.
Very good. Okay, so you are comparing that this is a special reflex and the effector areas are 2 different areas, milk ejection and
So
milk
we can
production.
say that
Okay?
regulation is both
Yeah.
sensory or neural and hormone.
Oh yeah, so give it a very nice name. It is partly
Neuroendocrine
neural and
regulation.
neural. So this reflex is a neuroendocrine reflex. Okay, this is neuro portion
Master namer here.
and this is the endocrine portion,
Neuroendocrine.
isn't it? So this reflex, beautiful reflex, a 2-in-1 reflex, is a neuroendocrine reflex. Right, Shiva?
Right.
Okay. So half of it is neural, half of it is endocrine. Okay? Anyhow, it's so easy. The last part, last thing which I am discussing with you and closing the discussion, it is about very special stimuli. Oxytocin release causes the milk ejection, we all know that. Okay? This is lazim for the expression of the milk so that baby can get the milk. But this oxytocin release is also facilitated by some other factors, very important factors, and this reflex is initiated. So this reflex is usually a tactile reflex. Tactile means touching, when the baby touches. Not only the baby touches, if the mother touches her own breast and she's in a phase of lactation, she has a baby, and she feeds the baby regularly. And if she touches her own nipple, that area, that touch will also stimulate the oxytocin release, and the milk can be expressed a little without squeezing. I'm not saying that squeezing, no, okay, just touching and manipulating, and that may cause appearance of few drops of milk over the breast, right? So this is again tactile, okay?
Right, okay.
One more thing. Tactile in a very special way also. Not touching the breast only. If the mother is having genital stimulation, okay, it's about the normal physiological intercourse, okay, a normal sexuality. Well, she's a mother, but she's a wife also, isn't it? Okay, so it's a basic process.
Poor woman.
Yeah, it's not poor woman. Why poor woman? Okay, it's a blessing for her in both ways.
So many tests.
But, okay, that's another thing. Genital stimulation will also send the signals to the hypothalamus, and that can also cause the appearance of milk. Look at amazing system, okay? These are the tactile areas, right? From the baby, okay? From the self-touch or from the relationship, from anything, okay? The tactile stimuli, definitely the maximum is coming from the baby when the baby suckles. That is maximum. Now this is one aspect. Second aspect is emotional aspect. Please look at the emotional aspect of release. Very interesting also. You might have seen this kind of thing in movies or dramas. If you see emotional dramas or movies sometimes from different social communities of the world, movies are made like this, okay? That the mother is away from the baby and she's a lactating mother, and she wants to approach the baby but she cannot by somehow, and the baby has started crying in some other area and she can hear the cry of the baby, okay? She's away from the baby and she's not approaching the baby. The cry of the baby is emotionally disturbing because she knows that it is the time of the feed and she wants to feed the baby. At that time, because of that emotional response, and she's restless at that time, she has the oxytocin release and the drops of the milk will appear on the surface of the breast. And her clothings are wet with the drops of the milk. That's a natural process. Alright? So, hearing the cry of the baby, okay? Looking at the baby, the baby is playing, or the baby is like laughing, or the mother is sleeping and the mother is watching really the baby with love, with emotions, and that emotion starts the secretion of the prolactin at that time, okay? This is the connection between the mother and the baby, okay? So these are the auditory and the visual stimuli, audio-visual stimuli, which can cause the release of oxytocin, okay? So it's coming not only from the tactile stimuli, it is also coming from the other stimuli. Thinking of the baby coming from cerebral cortex, just thinking of the baby, that my baby needs me, can cause that. Hearing the cry of the baby, looking at the baby with love, emotions, okay? Touching the baby or the baby touching the mother. This is the system really, okay? Anyway, that's so interesting about it. There are some factors which also inhibit the oxytocin secretion. You can read it yourself, very easy factors. It's very easy job. You have to read the presentation, inshallah, and that's it. Do you have any question about it?
Thank you.
Okay. Thank you.